Hello there. I am trying something new today. I am podcasting and also creating a video for YouTube. This is going to be multiple different resources for you to be able to connect with me. I'm still talking to a computer, but that's okay. I feel like we'll connect a little bit more if you can actually see my face while I'm talking to you. So whichever platform that you're using to get your next level information, I appreciate it. So we've got YouTube for video. You can also find this on my website, Marcia Jones NP, on the resources for next level nurse practitioners. And of course, on the podcast, you can listen to me. So there's a lot of things that I want to talk about today. So, we've been talking about hormones, the hormones of cancer. We've been talking about imbalances, adding these things into your practice, helping women to feel better, to live a life of vitality so that they can get themselves back, get back into their zone. So I want to talk to you about 5 common imbalances and what causes those imbalances is, so that you can be a little bit more in tune maybe with some of these things that are happening to the ladies that you're seeing in your practice. One of the things that we commonly hear is that I can't sleep, I can't fall asleep, I can't stay asleep. And one of the common medications that we do is, some people use Benadryl, some use hydroxyzine. There's multiple prescription medications that people will use to assist in sleeping. One of the other things we could use is melatonin. Now, melatonin is more on a natural spectrum of things that we can use, but we really need to look at the patient and see if we can figure out exactly what's happening to, determine why they can't fall asleep. And when we do that, we can treat that appropriately instead of just going, oh, okay, let's try melatonin. Melatonin is a very powerful antioxidant and has a lot of benefits to it. But when we're talking about, sleep and hormone balance, we want to make sure that we are balancing from a whole perspective instead of just kind of isolating one symptom. So our hormones actually control our circadian rhythm. So that is why we have to take a look at those and make sure that the estrogen, testosterone, progesterone, pregnenolone, all those things are in the right place so that we can help balance out things like night sweats, cortisol levels. They play another role in the circadian rhythm, whether you wake, where you go to sleep, and if there's darkness in the room. So many things factor into sleep. But you want to make sure that you check those hormones so that you're getting the right balance so that they'll be able to sleep and stay asleep and not have any of the side effects that we often get from some of those other medications. Plus, then we're not giving them a prescription. We're going to make them feel better all the way around. Now, I think one of the next biggest complaints that we hear from our patients is low energy. Like, oh, I just have no motivation. I'm tired all the time. I've lost my spark. I have no spunk. There was no energy. I just don't know, if I can go on. We hear this with a lot of women. And that's because estrogen is linked to the regulation of serotonin. So if our estrogen is off, our serotonin is off. If our serotonin is off, our neurotransmitters are affected, and so is our mood, and then our energy levels. So when we look at estrogen and make sure that it's balanced correctly, then we are affecting mood and serotonin. One of the other places that we need to look for serotonin imbalance issues is in the gut, because that's where the estrogen works to balance that serotonin. But that's a whole different topic. That's a different day. I got lots and lots of things to tell you all about. I don't want to bore you and I don't want to overload you all in one day, but we do need to look at estrogen and remember that estrogen isn't always the bad guy. I know it's very controversial, but if you look at what you're doing and you know what you're doing, then estrogen it's actually easy. Every woman should have estrogen, and we can give estrogen throughout the span of the life to be able to balance things so that she can live a healthy, happy life that's, like I said, full of energy. And, estrogen can be balanced in more ways than just giving estrogen therapy. And that's one of the other things that we talk about. I have a course coming up that I'm going to let you know about, where we talk about, estrogen, a lot about estrogen, the different forms of estrogen that you can, prescribe your patients, or the things that you can do with food to balance out estrogen levels. And there's other things that we can do supplement wise that helps to balance estrogen, which is not using an actual synthetic estrogen, which is one of the things that is controversial. So if we do it all right, we have nothing to worry about. We're protecting our female patients instead of putting them at risk. And we're going to boost and balance their moods. So now let's talk about the other thing we always hear about. This is number 3 of our 5 top imbalances that we see with women that can be hormone related. Weight gain. Who doesn't ask you about weight gain? And right now the trend is all about semaglutide. Now semaglutide helps to balance insulin levels. We know that helps with appetite and decreasing their weight. But does it help them in the long run if they're not getting the nutrition that they need to fuel their body? You can lose weight and not be healthy. So we want to make sure our patients are healthy. And if we balance their hormones, they're going to lose their weight, especially that midsection weight in the belly that most women over the age of 40 start to develop and just truly can't stand. I mean, like I said, that's one of my biggest complaints with my lady patients. But when we do that, when we balance the estrogen and also progesterone, we can help them to lose the belly fat. When we get the hormones in check and we start to teach them some of the healthier foods that they can eat so that they're getting the right nutrition that fuels the mitochondria, that helps to increase the metabolism, and that gets rid of that belly fat. So we want to support them in any way that we can, especially with fat distribution, insulin sensitivity, and appetite. And that is what we do when we balance out those hormones. So I do have, one of my upcoming things that we're going to talk about are the 5 hormones of cancer. But it's also about the 5 hormones of women that we really need to watch and look into. So just, there's lots of resources coming for you. I have so many things that I want to talk about. Anyway, so carrying on, mood swings. How often do you hear this one? Again, estrogen regulates serotonin levels, and fluctuations in estrogen levels, which happens throughout our cycles, throughout our menstrual cycles, and even beyond when we have menstrual cycles. That can cause these mood swings, irritability, depression. And the patient will come to you and say, I don't have any reason to be depressed. I don't understand. And then you might put them on an SSRI, and then they feel like they're coming out of their skin. Well, it's because they don't need extra serotonin. They need to be able to absorb the serotonin that they have and have it function properly. And so by balancing the hormones that work for the production of serotonin and the neurotransmitters that are associated with that, we can balance those moods. I've seen many people who were ready to call it quits in many areas of their life. They were just done with everything, so depressed. Their marriages were suffering, their jobs were suffering, all of their relationships were suffering. And when we balance those estrogen and progesterone levels, they're back to themselves. And so if you have someone that's at that phase that they're just desperate and they're feeling like they have no hope, there's no end in sight to just this melancholy that they have that they can't explain, especially when they're saying everything in my life is good, I have no reason to be depressed, why is this happening? You'll want to look at their hormones. You want to look at their hormone levels. Please don't just give them an SSRI, because it's not always going to help. SSRIs, if it's not indicated, are going to make someone feel more regressed, more down, and just detached from the world around them. And that's no way to live. We want them to live happy, healthy lives with energy and all the good things that go with it. So remember that progesterone has a calming effect. So if you have someone who's very anxious and on edge, progesterone can help to calm them down a little bit. But there's also supplements that work to balance your estrogen and your progesterone all together. It's one of those that are higher up in the chain. And if used properly, you can do a lot of things with one supplement. Now we have brain fog. You think the patients are telling you just can't think straight. This is one of the things that actually got me into hormones years and years ago. It's because I myself, this is how I always come up with stuff. Like if I need to figure it out for myself and I'm frustrated with the world, I'm going to figure it out. And then I know if I'm going through it, everyone else is going through it. So I can remember, about 10, 12 years ago, I was sitting at my desk and I'm thinking, I just can't get up. Like I'm right here going, I love what I do. I love my patients. It's patients that I couldn't wait to see, but I just didn't have the energy or the motivation to get up and go down the hallway one more time. I'm like, this isn't me. So, I did all the basic labs and I couldn't figure out what was going on with me. So I had actually stumbled upon a hormone class myself. And I went to this course and it was about bioidentical hormones and pellet therapy specifically. And I learned a lot. And I practiced with that for several years. But I always knew still there was something missing. And so to find that other missing piece, I had to go further. I had to get more education. I had to educate myself in some ways. But when I initially started with bioidentical hormones, I felt fantastic. It's like the sky opened up, the angels were singing, everything was coming, like, wow, there's light in my life again. But then, I had a lot of stress, I had a lot of things going on, and I'm like, I'm just not feeling that energy anymore. Well, there's reasons, because you can't just put hormones into someone without managing the whole person. So since the course that I went to was only talking about bioidentical hormones, they kind of left out some of the pieces. So that's where I come in, that I'm trying to help educate others that you got to look at the big picture. And with functional medicine, that's my love, and managing hormones, because it does the big picture. It helps with all of it. So that's what I'm teaching you, is all the things that I have learned that balance everything together. So that brain fog that comes with you just can't focus, you can't stay energized, it has to do about estrogen. There are so many estrogen receptors in the brain, you would be amazed. And they have a lot to do with the neurotransmitters. They have a lot to do with dopamine, serotonin, norepinephrine. So think about this. If we're managing things from estrogen, progesterone, testosterone, all of those female hormones that are playing together, and let's not forget cortisol, but we put all those things together and we're making someone happy. We're changing their life without treating a symptom. We're looking for the root cause. We're looking for the core of what's happening, and that is what we're treating and managing. So you want to make sure that you're really looking closely at the patients. And testosterone, that one is really helpful for integrity and function of the neurons. It actually helps with certain regions of the brain that have to do with cognition. And I haven't talked a lot about testosterone, but we will. We'll talk about that. In the course that I have on mastering, the female hormones, I do talk a lot about testosterone, because there's androgen testosterone, there's healthy levels of testosterone, there's a lot of things that go with that. And one of the biggest things that women benefit from when you get their testosterone levels correct is, brain function, bone health, because it's one of the best things that we have for osteoporosis. And yet it's not utilized very often, because in, traditional conventional medicine, no one teaches us about testosterone in women. And there's really no coverage for that. We do have compounding pharmacies that can help us to balance those, but we also have other ways that we can do it naturally. There's certain foods that we can do, certain supplements that we can use, just overall general things before going to testosterone creams or other therapies, pellet therapies, to utilize. We want to use the pellets and such as the last resort. So if they don't come up by fixing all the other things, then we can go into the pellets. And again, that's stuff that I talk about in the course that I have. So if you have not yet downloaded the PDF guide that I talked about last week for hormones, how to start by drawing the correct labs for women to check their hormones, go ahead and do that. It's at marciajones.com, marciajoneSNP.com/female hormone panel. So that's where you start to get that list of hormones that you can start to assess, and it gives you a little bit of information about every one of them, so you know what you're looking at. It's a nice guide for that. And you can also get the 5 signs of hormone imbalance that we've talked about here, a little bit more detail in a pretty little format. You can get that by going to marciajonesnp.com and scrolling down to the bottom. It's in the footer. You can, put in your information and it'll send it immediately right to you, right to your inbox for you. So you've got that. It's something that you can share with your patients. You could even print that out and put it in your waiting room, or we all have like these TV scrolly things in our rooms now. Like, put it up on there on a slideshow so that it can scroll, and it'll start to get your patients to ask you questions or to identify with some of the things that may be going on with them that they didn't think would be hormones. So that's another good resource for you. So I have so many things going on. I told you I took a break for a while, but I'm back. I'm back in full force. Like, I have so many things I want to do and I want to share, because I perfected this now, and I want to share it with the world, because there's only so many people that I can manage myself. So the more of us that are out there helping more women, the better it is. Because remember, hormone balance makes them feel better. They like that. but we know that we're protecting them from things like cancer, depression, anxiety, insomnia that leads into other issues. Breast cancer is the number one cause of cancer and death in females. And by putting these principles into your practice and learning how to manage these hormones, you're actually saving lives. You're saving homes. There's just so many things that I have seen over the years with what you can do to a person's life just by managing their hormones. I mean, you'll feel like $1 million. So I encourage you to do this. And so with that, I want to tell you that I am releasing the Master the Hormones of Cancer course November the 19th. That is when we're going to do our official release. That's 12 in-depth programs. If you want to know more about that, just go to my website, Marcia Jones NP, under the Next Level NP resources, and you'll find the information about the course and what all of the sections include. And I'm going to release it week by week for 12 weeks because there's so much information to absorb, and I want you to get it piece by piece. I want you to, it's like a foundation we want to build, just like when we tell people to set goals and we tell them to, start to put in one good thing, take out another, not to try to do everything all at once. So I'm trying to practice what we preach to our patients is you need one step at a time and build on that foundation. So when you've got the core concepts, it's going to come so easily to you. Even the cases that you think are going to be like hardcore, you're going to be like, oh wait, I got this. But if not, part of what goes along with that course is a group. It's Next Level NP membership community, where you get to come into the community and we can tell case studies. We can talk about people that you're seeing in the office that you're starting to put these principles into practice and you're not exactly sure what to do, or maybe you're still a little bit nervous about, is this right? Is this not right? This is where we come together and you can ask those questions. So it'll go along with the course outline, but also if you have things that come up that we haven't gotten to in the course yet and you'd like a little extra guidance with, that's what we do in that community. So I'm trying to make this simple. The big wonderful thing is if you register for that course now, within the next 2 weeks, you're going to get $500 off of the course just because you listen to this podcast or watch this video, wherever you're finding me. That's one of the perks and that's one of the bonuses. And put in the code Hormone Master. It's 2 words, capital Hormone, capital Master, and that is going to get you that $500 off of this 12-week program that is going to change your practice. You become a hormone expert. You're going to be one of the most sought after practitioners that there is. When you know how to talk to the female patient in front of you, when you know how to address their fears, when you know how to put all these things into action and give them hope and give them results, you are going to have a waiting list a mile long. You're going to have to trust me on this one. In this course, I do also give you some tips on starting a practice. So if it's something you want to do is start your hormone clinic, I've done it. I've helped others do it. I can help you with that too. So that's a ton of resources in this program. And if you have not already, make sure you subscribe to this podcast, share it with your colleagues so that they can, get information. Also, we are all in this together. And like I said, check out marciajonesnp.com underneath of the resources for Next Level Nurse Practitioners, because you never know what I'm going to put in there, because I just have so much to share and I want to share it with everyone that, we are in this together. We're on the front lines for saving women's lives emotionally, spiritually, and medically from cancer and from other demise. And we don't want to be that person that just gives them a pill. We want to be that person that looks deep inside and gives them hope and gives them answers and change their lives. So thank you for listening to me again today. I've got more in store for you next week. This was a little bit longer. I kind of like this video thing. So let me know how you feel about it. If you like being able to watch me talk to you. And since this was the first one, if anything's a little glitchy, I'm sorry. Give me your feedback. I do appreciate it. So like, subscribe, comment. We all got this. We're in this together. You guys take care, and I'll talk to you next week.